Hi folks, this is John Adams, the Rehab Documentation Guru, and today we're going to look at, is a family meddling in the safe and effective treatment of a patient? Here's an example of a patient that was put into a SNF setting because of an acute hospital stay and was recovering. The patient was alert and oriented times 3, but had some cognitive impairment, mostly in the area of safety and impulsiveness. And the PT very wisely, after assessing the patient for gait and balance and utilizing the Tinetti, scoring the patient at 11 out of 28, decided that it was a good idea to give the patient a goal for wheelchair mobility. This is appropriate. We want the patients to be able to access their community. In this case, the community was the skilled nursing facility the patient was staying in. We want them to be able to have some independence, but we have to be able to keep them safe within their current limitations. And so based on the findings, the therapist had a very clinically appropriate goal for the patient. Now keep in mind this patient is alert and oriented times 3, but is impulsive, but they're pretty with it and they can say yes and no to treatment. And from all indications, the patient had agreed to this goal. Now, the goal ended up being discharged on a subsequent progress note, and this was the explanation. The patient's family refuses to allow the patient to use the wheelchair. Now, number one, who should be advocating for the patient and their health care? Well, perhaps the patient's not safe enough to make the decision to, let's say, go home. But when it comes to keeping the patient safe in a facility with 24-hour nursing care, the patient has a right, at least in some instances, to make some decisions for themselves. And if the patient agreed to a wheelchair mobility goal, there's no reason to take that away from them. Secondly, the PT's reasoning behind the goal was purely clinically based with good assessment skills and analysis of what those assessments meant, in this case the Tinetti and the patient's impulsivity. So the fact that the goal was discharged based on something other than the therapist's decision making is not a good sign either. And then finally, the family deciding for the patient. This really is abusive behavior. The patient's family has no right to make this decision in this case. I can understand what their motivation might be. Perhaps the patient's generally kind of lazy and is losing functionality, and the family wants to make sure they keep moving and they don't want them to become wheelchair bound. I can understand that. But in this case, there's good clinical rationale to utilize the wheelchair. And in fact, there's clinical rationale to exclude the patient from ambulating by themselves. And so this was an all-around bad decision. And instead of the therapist sticking to their guns for the patient's rights to a safe environment and safe and effective treatment and a clinically based decision, the therapist capitulated, gave in to the family, and discharged the goal. And now we've set up the patient for a fall. Now this was documented. Now imagine for a moment that the next day after this goal was documented, or this was documented, the patient had a fall with an injury, and state came in to evaluate the fall with injury, which is required by law when there's a fall with an injury in a nursing home. And they find out that PT was working on wheelchair mobility, and now they've discharged the goal, and the patient had nothing to do with it. Now the patient has a right to advocate for their own health care. And when you're alert and oriented times 3, you might have some safety awareness issues, but you can generally say yes and no, and the patient had agreed to this goal as being what they wanted. So this is an all-around potentially very bad situation, and I hope you can see that. So what's the takeaway from this? Well, if you have a patient that can advocate for themselves on certain levels, you need to give them that ability. For one, you can't let even powers of attorney dictate exactly what you are going to do, because your secondary obligation, not only to the patient, but is also to provide safe and effective treatment. And in this case, this was not done. Anyway, I hope you found this helpful. This is John Adamson, the Rehab Documentation Guru. Please like and subscribe, and please leave me a comment related to any questions comments that you'd like to talk about potentially in future videos. And anyway, thank you. Make sure that you get paid for what you do. Take care and God bless.